So, as we get further into cold and flu season, I just have something to say. Your treatment plan is only as good as the information that you provide, and you're only hurting yourself by trying to game the system to get the doctor to give you what you think you need. I'm Dr. Leslie McElrath. I'm a board certified family physician. I'm in Akron, Ohio, and this is a thing that I see a lot, especially the further we get into cold and flu season. Patients think that they know what's going on with them, and so they know the treatment that they need because either a significant other has had a similar treatment, or, in the past, the doctor has given them this treatment. And so you need to just give me this treatment that I know that I need. But the problem with that is my recommendations are based upon the symptoms that you currently have right now, not the symptoms that your son had 2 weeks ago and now you're having similar symptoms. Like there's a lot that goes into the decision between one treatment plan and another treatment plan. And when you're trying to get the doctor to give you what you think you need as opposed to what you actually need, the likelihood is that you'll actually hurt yourself way more than the kind of annoyance of having to explain to you why you don't actually need this. I sometimes have these scenarios where I'm working with a patient virtually, and they're like, well, my wife just went to the doctor and they gave her this. And I'm like, yeah, but your wife has had symptoms for 2 weeks and you've had them for 2 days. Her symptoms are completely different. I would have given her that, but I don't think that you need that at this point because the symptoms are different. And symptoms, that's the weird thing about symptoms, is that they look similar when they're not. And so rather than trying to convince the doctor to give you what you think you need, instead just provide the information so that the doctor can tell you what you actually need. Because sometimes what you need is the thing that you think you need. And I always want patients to advocate for themselves. If you don't agree with something, go get a second opinion. But don't try to fabricate things or argue with the doctor. If you don't agree with what that doctor is saying, go to a different one. If they give you a different answer, then that's fine. But make sure that you're doing this in such a way where you are improving your chances of getting the proper treatment, not just the treatment that you want. That's all I gotta say. All right, have a good day.